On Friday, I had the most ambitious conversation that I've ever had with a director of adult social care. We were talking about starting a new wellbeing team in their area, but what's different is it would include reablement team members, people delivering practical support in a home care kind of way, and prevention, sort of a version of social prescribing that also includes our circle family approach. Of course, this sounds a bit like what we're doing in Thurrock, but where we see this happening a bit differently is by people having wearables. So the people we're supporting having wearables so that we can track health outcomes and health data as soon as they leave hospital. And of course, there'd be no handoff from reablement to home care because that would be able to happen completely seamlessly with this team. And there'd be a significant preventative element that would hope would stop people going into hospital through circle family and community circles too. So that sounds really exciting. The commissioners will be invited to be part of this new programme that Toby Lowe from Newcastle University is doing. I think that's Newcastle Business School, supported by the RSA, linked to Social Care Future and supported by Easier Inc. and Collaborate. And there's an initial event for that in December, and then the programme starts in earnest in January. What makes this even more exciting is that the commissioners have already expressed interest in themselves becoming a self-managed team. And because they will be changing the commissioning environment for providers, we've also looked at, once the first wellbeing team has got going, is working, and we've taken the learning from that, then doing a year's programme with all the other local providers to support them to move in that direction for a new framework that would come into place in 2021. And if all this happens, and of course none of this is given and would have to be socialised and costed, but it's the excitement of somebody thinking that way that I'm really inspired by. But if all this happens, that would mean the end of traditional home care in that area, commissioned differently, not through time and task, and every provider offering reablement support, community support, as well as traditional home care, the end of traditional home care as we know it. So I will keep you posted as these conversations develop, but this could be transformative for home care as we know it.